What is a sinus infection? Welcome to Dr. B Talks About Sinusitis with me, Dr. John Burgoyne, a practicing otolaryngologist in Austin, Texas with over 30 years experience treating sinus infections. So the first thing that you have to know if you're going to ask what is a sinus infection is, well, what are the sinuses? Now I have another Dr. B Talks About that goes into this in a little more detail, but essentially sinuses are air-filled cavities in the bones of the face surrounding the nose. So we have sinuses behind our cheeks, up in the forehead, between the eyes, and it doesn't show it real well, but kind of behind the nose. Sinuses are big boxes with tiny, tiny openings. So this is a CT scan. This shows the big, empty, full of air sinuses. Air is black on these scans. And the openings are little. And I'm only showing you this one because all of the other sinuses, these ones and the ones in the forehead and the ones in the back, their openings are so little you can't see them at all. Okay, so big boxes, tiny openings. Lining the sinuses are these cells that have these little hair-like things called cilia that sweep like this. It also has mucus-making cells. So all lining on the inside here, we have cells that make mucus and then sweep that mucus into the nose. They do that all the time, because you need to have this mucus to keep the lining tissue moist so it doesn't dry out, and you need to move it out so it doesn't glob up and get icky. The other thing is that you have these spaces, and the nose is just a filthy place. There's so much bacteria in the nose, and bacteria will get in there and cause trouble unless you have this mucociliary flow. So you have the mucus and it's sweeping out. It'll sweep out, it says particulate. It's really the bacteria that we're worried about because the opening is so small that little particles hardly ever get in there. But we have to have the mucociliary flow. If the openings get blocked, or the sweeping cilia don't work, mucus and bacteria become trapped, resulting in an infection. And it's kind of a vicious cycle because the infection causes swelling at the openings, which can therefore make things get more trapped, which can allow the infection to get going. So here's a picture of a CAT scan with normal open sinuses full of air. This one's all full of ick because it had an infection. So what blocks sinus openings? Well, the easiest answer, and in a lot of ways the most common answer, is that the lining tissue is swollen. A virus can cause the lining tissue to swell. Allergies can cause the lining tissue to swell. You can have an injury, like if you get mashed in the nose, all of your lining tissue will swell up. And if that happens, then instead of having a nice opening from the sinus into the nose, it'll get blocked. And then the stuff that's in there just can't get out. Inevitably, because there's bacteria around, well, not quite inevitably, but frequently because there's bacteria around, that bacteria can get ahead of our body's defenses and you'll get a buildup of ick inside the sinuses. Okay, so lining tissue swelling is one thing that blocks the openings. You can also just have an abnormal anatomy problem. Like you can have narrow openings that are just narrower than they should be, so they're easier for them to get blocked. You can have a deviated septum that can make it so that the opening has a harder time being open. You can imagine that if the sinuses were trying to drain here, and you have this big glob blocking over to the side, it can make it harder to drain. So if you have that crooked septum and that's pushing things over, even though your opening itself might be okay, you can still get a sinus infection. So lining tissue swelling, abnormal anatomy. You can also have polyps or growths in the nose. Polyps in the nose are areas where the lining tissue has become so swollen it hangs down in globs. And those globs can block an otherwise open opening, causing sinus infection, or the glob itself can be right at the opening, causing sinus infections. So those are the sorts of things that cause sinus infection. But I want you to really understand that the problem with sinus infections is almost 100% a problem of the sinus opening being blocked. It's not from some super bacteria that got you. It's because the openings got you, or the lack thereof got you. Viruses can cause swelling in the sinuses, and yeah, I guess technically that's a viral sinus infection. But really, if it swells them shut, you're gonna get a bacterial infection on top of that. We talk about simple acute sinusitis. That means you were fine and you had a sinus infection and it went away and you didn't have it again for a long time. Or chronic sinusitis, which is both sinusitis that really never kind of goes away, or simple infections that happen frequently. Simple sinusitis, it's infrequent. I mean, if you're having it more than once a year, you're not having simple acute sinusitis. It usually resolves quickly, usually within a week or two. And over-the-counter medicines are often enough. If not, a short course of antibiotics is appropriate. So this is the one where your doctor will give you one of these Z-packs or a week's worth of amoxicillin or something, and that's completely appropriate. However, recurrent or chronic sinusitis, that means, I mean, if it's chronic, it's slow to resolve. It needs longer courses of antibiotics. And in addition to the longer course of antibiotics, to reduce the swelling at the openings, we frequently have to give oral steroids, okay? Because it's indicative of some underlying issue. Either the septum's crooked, the openings are too small, you've had thickening because of allergies, you have thickening because of repeated infections. And usually, if we can get it to resolve with a combination of antibiotics and steroids, I typically have people stay on nasal steroid sprays if they can. The oral steroids will shrink the lining tissue, which therefore makes the openings bigger. And the nasal sprays can keep the tissue from swelling back up again. These nasal steroid sprays, we're talking like Flonase or Nasacort, they're not super good at shrinking the tissue, but they're reasonably good at keeping it from swelling back up again. So with this recurrent or chronic sinusitis, it's important to control the allergies because they're leading to the swelling of the lining tissue. Maintenance on nasal sprays, as I just said, but also we need to get a CT scan so we can see what anatomic problems there are, and also to make sure there's not some other problem. We wouldn't want there to be a growth or polyps that are blocking the sinus openings and not know about that. And if you have this kind of chronic recurrent sinusitis, you may need surgery to fix those openings so the sinus infections don't happen. So who needs surgery? Well, for me to recommend surgery, we need a couple of things. First of all, there needs to be an identifiable problem to fix, all right? If I can't see a problem with the anatomy, what am I going to do with surgery? So you need to have an identifiable problem to fix, and those we determine by getting a CT scan. And, this is very important, and you have to have symptoms bad enough to make it worth it, okay? So, in other words, if, let's say you had a CAT scan because you were bopped on the head, and they did a CAT scan and they said, oh, look, we found a problem in your sinuses. But you've never noticed you had a sinus problem. You breathe fine, you don't have headaches, you don't have icky goop, none of that stuff. You don't need surgery just because your sinus openings are messed up. Your body's doing fine with that. So just having an anatomic abnormality in and of itself is not a reason to have an operation. And what does it mean, symptoms bad enough to make it worth it? Well, if you have a simple sinus infection every 2 years and it goes away either on its own or with a round of antibiotics, don't have surgery. If you have repeated episodes that require 3 weeks of antibiotics and 10 days of steroids to make it go away, and those are happening despite being on nasal steroid sprays, for me, if that's happening more than about twice a year, then it's going to be worth it to you to have sinus surgery. Occasionally, like rarely, somebody will have a terrible acute sinus infection that'll that will be like spreading into their eye or brain or something. And probably, I don't know, a dozen times in the last 30 years, I've had somebody with a terrible acute sinus infection that required emergency surgery. That's super rare. As far as what happens with surgery and the recovery from it, well, that's another talk. Hopefully this will have been helpful for you to understand sinusitis. Remember, it's because of your anatomy, not because of a superbug. It's not changing antibiotics usually only helps a very small amount. And it's more the combination of antibiotics and steroids that will cure the difficult cases. And in the really difficult cases, we recommend surgery. Remember, Dr. B talks about is not the practice of medicine in and of itself, okay? Please, if you have a problem with your sinuses, go see your doctor. And if you're in the Austin area, you're certainly welcome to come see me. You can find me online very easily. I'm Dr. John Burgoyne. And also, if you enjoyed this, make sure and press the like button down below. Share it. Subscribe to our channel and check out our other Dr. B Talks About videos. Thank you.